Delighted to finally get Suchi to visit us. We first met in 2010 when you were a grad student at Stanford. I remember we discussed MRI scans and metabolomics and other things, and I knew then this was a brilliant person I wanted to track, and that's so true. We've seen each other at many conferences, and I'm always impressed by the things she's up to these days. She is the John C. Malone Associate Professor of Computer Science at the Whiting School at the Bloomberg School of Public Health, founding director of the Malone Center for Engineering and Healthcare at Johns Hopkins, and the founder of Beijing Health. She's got a bunch of grants. She was named one of the AI's 10 to watch, 35 under 35 a few years ago, a whole bunch of other awards. It's just amazing she's worked. And I'm delighted to hear what she's up to these days. So when you're ready, Suchi, the floor is yours.
Absolutely. Thanks so much, Russ. Very kind of you. And then I also wanted to introduce Adarsh, who's with me. He's a senior graduate student in his 5th year, but he has far surpassed what most 5th years get done. A lot of the work I'm going to present today, Adarsh has been a total partner in crime and has in fact led some of it ahead of me. So Adarsh will co-present some of the talk with me, and I'm super excited to talk about this direction. So with that, let me share my slides. And again, please feel free to interrupt along the way. So around 2015, 2016 is, I had a family event that helped me, so I've been working machine learning AI for a long time, around 2010, or 2008 or 9 is when I started feeling like, a lot of my early work, I got into the field of AI very early, was very interested in time series data, more generally broadly interested in how do we draw reliable inferences from really messy data. Around 2009 and 10, there was this sort of new big regulation called the High-Tech Act and Affordable Care Act happening, which means suddenly medicine as a field was going to change because so much more data was going to be available that historically didn't exist. And medical data, unlike other data fields, is very, it's not like, you have many more types of data. These data are really messy. There's lots of sources of bias, and the quality of the inferences have to be really good for people to want to adopt it, which means it poses many, many challenges for us as AI methods developers in thinking through what do we need to do to make AI ready for harnessing the vast amount of data that's becoming available or become available over the last 10 years. And then also, it's a really important high impact application. So that's sort of what's motivated this whole thread of work for me. While I'll focus some of my motivations for medicine, really this is kind of across the board important because, over the last decade, we've also seen people in education, criminal justice, applications springing up across the board as people have gotten excited about AI ML. And I like to show this because, as I've done more and more cross-disciplinary work with people from other disciplines, I think it sort of felt that many people outside the discipline, this is especially true in the US with funding agencies. 3-4 years ago, we were going through this time and age where every other discipline would view AI as this magical wand where, it's gonna transform their discipline entirely. But as someone who develops methods in this area, as you start partnering, you realize AI methods that we deploy today are kind of brittle, and you really need experienced practitioners, methods developers, to truly understand where the holes are and what does and doesn't work, and in order to build things that are actually going to be high quality enough to be of use, right? And the reason this awareness is so important to bring to other fields is because we don't want to end up in another AI winter where we overpromise and underdeliver, right? So 2 things. One, bring up, we know there are holes, we know it can be built, we know it's possible, but it requires extreme care and diligence to do it well. And then also, it's not easy in a way that you just download some software and it's just going to work. You have to think extremely hard about your use case, your discipline, what are you hoping to accomplish? And some of that will show through in the talk we give today. Now, why is this happening? Because historically, we focused very much on evaluating performance using one or two slim data sets that we can easily describe, and then using that to claim superiority, when in reality, when you actually start deploying something, the first 10%, I almost think that AUC evaluation on one or two data sets showing we beat SOTA is like probably 10% of the work or 20% of the work. And when you go from there to start actually thinking about what does it take to succeed, it's the remainder 80%. So actually, if you guys don't mind, I would love to hear a little bit, if you can do a Zoom hand wave of like, how many of you are interested, like, are actively working on this, have struggled with it, and are like thinking about research in this space, or, recognize that this is a problem? I'm seeing a few thumbs up. So I would say every fifth person in this room, which is great. Awesome. So I'll now quickly talk about a couple of examples. So you might have heard of this. This is a study where they took data on chest x-rays. They were trying to predict pneumonia. They used data from 3 hospitals. It worked really well in the first, and the second, when they tried to generalize it, didn't work. Turns out they were learning all sorts of data, site-specific biases that didn't generalize. This is another example of like predictive policing, now commonly cited, of like system in LA, where they, like in California, where they deployed it. The system was driving, who gets monitored, but the more model focused on who should get monitored, the more they were going to those neighborhoods collecting more data. In other words, they had more data on people in neighborhoods where they predicted there was going to be a crime, but they were collecting less data on the other neighborhoods. So there was this feedback loop that was reinforcing additional crime detection in some neighborhoods and ignoring other neighborhoods. This is the famous Panda example. I'm sure you all seen, like model blind spots, where because of the training algorithm used, model performs weirdly in places that we don't fully understand. And then this is an example from our own work where, as in data sets, when we are simply doing naive supervised learning, it's really easy to start memorizing what's in the data. And part of the memorization could be, you could be learning policies that exist in the data that don't generalize over time. And as a result, your predictive performance will also struggle as policies change, because any data set that captures human behavior, policies will change. So all of that leads to this thing, like there's an enormous opportunity for us computer scientists as a field to learn from other disciplines. And this has sort of been the last 3 years have been, evangelizing us trying to take more lessons from other fields like nuclear engineering, civil engineering, where there's this in high stakes domains where people have built a whole discipline around safety, reliability, and thinking hard about what do you need to do in this discipline in order to be able to have solutions where you can have comfort that they're going to work and work with 99.99999% reliability. And in ML, we really don't think about that end to end at all. We tend to mostly focus on performance on a data set, and then we're done. And then it's somebody else's job. And, beyond these, another area where there's like lots of inspiration to draw from is medicine, like place where, we take drugs, we want these drugs to be with COVID, right? Like we're always doing monitoring on understanding, is it working? Is it not working? Where is it not working? And especially in these high stakes domains, the FDA as a body exists to regulate and monitor. Is it working? Is it not working? Where is it working? When is it not working? And so I think there's like lots of benefit in learning from these other disciplines where safety has been crucial to say, what can we learn and then borrow and then think about what do we need to do in our field to fill in like the gaps beyond the deep areas where we tend to have expertise. So high level, back in January 2019, we did this tutorial on this topic, which is what's going to take to build safe and reliable machine learning. It borrows from other fields and explains high level, like key areas of how, reliability engineering means, ways to think about failure prevention, ways to think about, one second, I've lost my cursor. Ways to think about safety, failure prevention, ways to think about identifying failures, before deployment, so that's failure prevention. Then there is the failure identification while the system is in use, so real-time reliability monitoring and audits. And then also any live system you want to be able to maintain as you see shifts. And kind of summarizing, this is back in Jan 2019. Already there's been a lot of work in the field in the last 2 to 3 years. I've done a couple of other tutorials on the topic since, one that we'll point to towards the end, but it sort of gives you a link to how do we map our own terminology to these areas and where work is going. So if you're interested in this topic, I recommend this as a starting point. Today, we're not going to dive into all of this because we have limited time. So we were going to give you a sneak peek into 2 areas. The first is this notion of like, how do we build learning methods that are more robust and lead to algorithms that are safe? So that's the first area we're going to tackle. And then the second area we're going to tackle is about how do we build evaluation methods that allow us to more proactively identify when our methods are failing. Both of these areas we've collaborated very tightly with the FDA on. This is something in the most recent FDA regulation. They cite all of this work and is very much the basis of like what's being, like as they're thinking about how do we try to understand algorithmic stability, reliability, and safety. They're very much thinking of, like these ideas that they're using to inspire, like what should the end-to-end framework look like? Okay, so let's go into learning. So you've all heard, and in the 90s and the 2000s, there's been a huge amount of work in transfer learning or domain adaptation, right? So you have, data from like your domain, like let's say you've learned from one data set, now you get a new data set, you want to be able to do well in that. So in machine learning, historically, we've thought about it as transfer learning where, you have an estimator and then you basically are going to take, your estimator allows you to do some prediction. There's some inputs on a sample you predict. And often a predictor is some version of like, inputs and some weighted combination of inputs, like features to give you an output. And so transfer learning methods, there are many different kinds, but effectively you're doing some variant of either retraining or reweighting based on new data sets to be able to work well or re-optimize or retune it for this new data set, right? So that's sort of like commonly how we've dealt with shifts. So why am I talking about shifts? Often a big source of AI safety in machine learning world machine learning tooling has to do with the fact that the machine learning is not deterministic, it's stochastic. So in other kinds of software tend to be deterministic. In machine learning, it's stochastic, and the stochasticity comes from the fact that it takes inputs. The inputs themselves can shift over time, and then as you have shifting inputs, you have, you apply the program, you get an output, and then as a result, if the program was trained on to expect inputs of certain types or distributions of inputs of certain type, as the inputs shift, it can shift subtly. We may or may not recognize it in all the ways in which it's shifting, but as a result, the performance of the algorithm starts to deteriorate in specific cases, deteriorate in specific subpopulations, deteriorate in specific scenarios. And so in a way, we need to be able to adapt to these shifts or to be able to know when a shift is happening that we're not ready for, right? So that would be sort of the ideal desirable performance. And the transfer learning was historically a way to do that, but it was easier to think about it when you had fixed data sets. In reality, when we're going live, shifts can be subtle, shifts can occur in many different forms. You actually want to be able to learn, and there are shifts that we know upfront we don't want to be sensitive to. We want to be invariant to it. So you want to be able to specify and give guarantees, and which is independent of a data set. So that's where we need something more than transfer learning. Now, a second thing that people have developed over the course of in the last few years that have gotten on a lot of excitement is invariant risk minimization, which is learning representations that are invariant to certain shifts. That's how you can think of it, right? So here in IRM, what people do is they basically take a collection of data sets, and the idea is let's find, and these data sets come from different environments, and the idea is when you're doing learning, you're often learning a base set, right? Some representation that's being used as the basis for prediction. And so the question here then is, can we learn representations or an estimator or a learning a model that is invariant to shifts across these data sets that represent different environments? The good news is it's more robust than any of our previous approaches because it's able to explicitly optimize for finding things that generalize across environments as opposed to things that don't generalize. So that's good. The not so great news here is that it's highly dependent on your data sets. And today in machine learning, we can collect data set 1, 2, 3. We don't like saying it's invariant to a data set. A data set is not a good description of an environment. All it is data. And in order to be able to learn something that is guaranteed to be invariant, the assumption here is like you have infinite, you have enough data to support that it can learn it, right? In safety, you want a more declarative definition of like, these are shifts we are invariant to, these are shifts we're not invariant to. Why? Because you want to be able to guarantee that it's not going to misbehave, right? That's very important from a regulatory standpoint. They need to understand when does it do well, when does it not do well. And they want declarative statements up front. They want like an invariant specification up front. And IRM doesn't like allow you to give a very clear invariant specification. It doesn't have like mechanisms that we are guaranteed if these shifts happen will be invariant. Instead, it relies on sort of implicitly learning from data. And if you have enough data, it can learn an invariance shift. But it, in some scenarios, you may have domain knowledge to guide certain kinds of invariances you'd want, whether or not you have the data for it. And that's something like today, we don't have an easy way to do. So I'm going to describe like 5 years of an, I guess 3-4 years now of an alternative line of work, which is more sort of brings together machine learning and causal inference to be able to do, to be able to basically do shift stable learning algorithms. And the super nice thing about these, so the bad thing is you have to learn things about causal inference. So that often freaks people out. The good news is if you can, these algorithms have guarantees. They can give you upfront declarative guarantees on, like shifts that you would be invariant to, shifts that you'd be mechanistically protected against, which is really nice from a safety, reliability, regulatory standpoint. I'll pause. Any questions before I progress?
I have a question.
Yeah, Matt.
So can you talk a little bit about how liability and regulation fit into this? Because it seems like if you go to an economist and they say, well, if you put out a bad algorithm and you're not penalized, of course you're not going to be robust. And if the market punishes you for that, then you will make it robust. Is that too naive?
Yeah, there are many, many ways to put incentives. One way to put incentive is you just don't get paid for it, or you get paid for it, right? The way like in other fields, like for instance, in medicine, the way medicine has approached this is like a more paternalistic point of view. And let me explain what I mean by that. So their assumption is most people are not experts. They don't have the ability to go deep and evaluate for themselves, right? And we saw this in AI. There are many companies that have come and marketed themselves over the top. And then people on the other end are sitting there saying, this sounds great, but I don't have any way of evaluating. And so you're kind of left in the situation where people with the biggest marketing budgets win. And so to sidestep that, the FDA has experts, who are domain experts in the field, who sit down and they build knowledge of how to poke holes at something to get to a place of comfort. And they also have punitive measures where if you don't do this, you're going to be in trouble. I personally think the bottleneck with that approach is it's a central body. It's very slow. It doesn't scale. That's the bad thing. The good thing is the discipline of how they approach it is actually quite nice and rigorous. So, maybe there's a better way to do it. That's best of both worlds. But in the very least, like learning from the end to end there has been for me, very interesting. And so that's the idea, right? We want to facilitate that level of end-to-end thinking. And obviously, we want developers in our field, we want researchers in our field to bring that level of rigor, not rely on reviewers to be the only safeguards. You want yourself to be a safeguard, right? Yeah, and eventually once so in regulatory land, people won't even get to market if you don't get clearance, right? So then there's like the simple thing. And the other example is, like once you are FDA graded, you get paid more for things. So if there was a similar corollary, that would be the easy way to turn it into a marketed version. But in the very least, in the meantime, we as researchers should become smarter about it.
Cool, thank you.
Yeah, any other questions? Okay, yeah, Russ, go ahead.
Well, to make sure that I'm looking forward to seeing some examples of some of these invariants, but that's going to come in the next few slides, I hope.
Yes, actually, I'm going to send you a paper that's going to come out in the New England Journal of Medicine in the next couple of weeks, which is probably the most thorough write-up. It involved a ton of people, but it basically talks about all the different forms of shifts from a very practical standpoint, and then identification and mitigation strategies for it. So I'll send you that when it's ready. I'm not going to try to cover all that in the talk today. What I was going to do is to say, let's say there are lots of different shifts. We can think there's the user point of view on different types of shifts, and then there is the mathematical point of view. I'm going to give the mathematical point of view today. So mathematically, any of these shifts that we're talking about can actually be written out in terms of just, you have one, like almost any data set, any learning problem using a data set can be turned into some notion of learning a target distribution, right? You're trying to learn P of Y given a whole bunch of inputs, right? And so effectively, including imaging problems, right, which we tend to no longer think of as graphically, but you can think of it as learning one big joint probability distribution, right? That's what effectively your, any learner is doing that. It's optimizing Y given a whole bunch of inputs and you're subject to some constraints. And so here's sort of the key idea, which is you can take any example and write it up as some data generating distribution, where some variables are measured explicitly, other variables are implicit, right? But you can write it up theoretically as some data generating distribution. I'm taking this X-ray example and writing it as a very simple DGP, data generating distribution here, where basically you have, 4 variables. There's the department, which is the hospital where this image was generated. T is like whether the person has pneumonia or not. F is like, depending on the department where it was generated, the scanner had certain style features that it would impose. So that's site specific. And then the actual image was a combination of like many things, but here very simplistically, we've said whether or not you have pneumonia. And then, the actual image has whether or not you have pneumonia, you have a certain expectation of what your chest X-ray might look like, plus, where your image happened to be taken. So there may be certain style specific features on the image, right? So like here in this case, there was site style specific features here that it was learning, and it was using that to be able to improve prediction in a site specific way, but it wasn't generalizing. And you ideally don't want to learn that. You don't want to learn these features that don't generalize. You don't want to learn relationships that are not going to generalize, right? You want to be invariant to it. So in this graph, what that means is you have a joint distribution. Certain dependencies that are marked here as green are green and stable, and then other dependencies that are unstable are marked as red. And intuitively, you can think of it as there's some data generating process, there are dependencies in that, whether or not you know the graph explicitly, you can always use graphical learning techniques to uncover a graph from data. And, like you can learn a PDAG from data or partial acyclic graph PAG from data in order to conceptualize it this way. But once you conceptualize it this way, you can kind of think of it as like there are edges or dependencies that are stable and there are others that are not. Okay, so that's sort of the most basic setup. And now that you know something is stable and something is not, you can basically represent almost every shift. So where is that paper? This paper, if you're interested, you can go to this paper. But what this paper says is every paper that we've come up with ways of like doing graph pruning, which helps you say, let's drop some of the features and not condition on it. By not conditioning on it, we're going to get a more stable algorithm. That's an example of graph pruning. But basically, you can represent anything that involves tweaking features or the dependencies that we learn, there is a collection of algorithms now on the topic. All of them can be like put under this idea of like there's a big graph and you're dropping edges and you're learning certain edges. And depending on which edges you learn and which edges you drop, you're going to get algorithms with different stability, accuracy characteristics. And the most accurate algorithms are the ones that learn only the stable edges and drop all unstable edges. But often in reality, you need operators to be able to do that. So I'm going to describe one algorithm to you. So here in this example, basically, your perfect learning algorithm would be one which like doesn't learn the edge from D to F, but learns all the other edges because it learns all the other relationships and it's able to produce the best, most efficient estimator that is stable. Any questions before I proceed? Does the setup make sense? Okay, I'll assume it makes sense. And so I'll give you one example algorithm. So this is an algorithm we call the surgery estimator. It produces, I won't have the time to go into details of this only at a high level. The reason I picked this algorithm as an example is because one, because of the theoretical guarantees that you can give, right? So what are the theoretical guarantees you can give? So first is that it's sound, it's complete, and it's optimal. So what do we mean by that? So let's start with optimality. So here, what this is saying is among the set of all estimators where you're only keeping, like what this estimator will do is basically say, here are the edges we want to delete, and here are the other edges we want to keep, okay? And we can have many different environments. In these different environments, people can vary. People can vary the invariances that we want to guarantee. As we go to new environments, let's say there's an adversary. That adversary can produce data sets where you can vary the distribution on those edges any which way this adversary likes, including, they can go rogue and vary them in wild ways. And what we're guaranteeing is that this estimator is the best estimator you can, most accurate estimator you can learn, conditioned on the fact that it's going to be invariant to those it's going to be invariant to all of those edges that we said we wanted to be invariant to because we were protecting against the worst case adversary. So that's effectively the guarantee. I'm trying to make it intuitive for people who don't want to read the math, but intuitively that's what it means. That means we're saying it's basically like a worst case guarantee, which is saying adversary can come in, some edges that are unstable, they can go rogue in varying it. And what we're going to tell you is that we will protect against, we can upfront give you guarantee that we'll protect against any amount of adversarial variation on those edges because we're going to be fully invariant to it and learn an estimator within the class that is as efficient as possible.
So just to clarify, you start with a graph of the world, that's like a Bayesian net or something that describes how the world is, which is correct. And then you say, an adversary gets to change certain things, but you started by having a graph of the world. You started having this thing with all the details.
We don't have to have a graph of the world. I'm representing it graphically, Russ. What we need is a person to say, I want to be invariant to this. You can write that in English. I want to be variant to these dependencies. So an example would be, I want to be invariant to practice patterns changing in this way. I want to be invariant to physicians changing their ordering patterns. I want to be invariant to others. Do you want to give some examples from the much, much bigger example that you've run recently?
Yeah, changes in, as Suchi was mentioned, practice patterns, so changes in timing of measurements or when things are measured, on whom sort of lab measurements are taken. So for example, things related to decision-making that generates the data. is one example of the types of shifts.
Does this include batch effects? I've got an MRI machine here in Edmonton and one of them in Baltimore. And I want to be able to say it's an invariant machine I use, because if you can solve batch effects, that'd be amazing.
Yeah, so that's right. So you know, to like basically batch effects would be captured here as well, right? So if you effectively take the raw output that comes out and then you're conceptually laying it all out, effectively there's dependency on the output, the raw output and the transformed output, and something is happening in the middle, right? And you're denormalizing for site specific or instrument specific biases. So if you lay that all out, it's effectively a big joint distribution.
Yes.
And right now, today we do sequential, right? We do first part, then second part, then third part, and we've built in all these invariances. And so, yes, theoretically, Russ, you could write it all out, and like these would be invariances you want to learn, which, you know, people are now saying we could, you know, now people are increasingly trying to do it all in one big step, right? As opposed to like building people's way through it. That's right.
I'm going to come back to this, but thank you. Good.
Yeah. So theoretically, this allows you to represent pretty much any data problem where you have inputs, you're trying to make some output, there's some dependencies, transformations that need to happen. And, you know, like there are different environments, and across these different environments, there are environmental variables that will help you represent different copies, right? So like here in this case, you know, F could be in department 1, F looks like this. In department 2, F looks like something else, etc. And so one, it's saying this algorithm is effectively given a graph and given an invariance, a desirable invariance spec, which is I want to learn an estimator that is invariant to certain edges, like certain shifts. That's what it wants up front. It wants you to tell you, it asks for an invariance spec. It'll come out with an output. And what that output is sound, complete, and optimal. So I should have done soundness and completeness. So sound means if it comes out and says there doesn't exist an estimator, what that's telling you is in this data set, it is not possible for you to learn. It's not possible for you to learn a predictor that is indeed stable to all of these invariances. It's not possible, which is really good because you actually want, from a regulatory standpoint, you want to be able to give guarantees. You want to be able to say things like, I am definitely invariant to shifts in, you know, the instruments, or shifts in practice patterns, or shifts in demographic, or shifts in certain, you know, variables in inputs. And effectively, it's leveraging the graph to see, can it actually learn a distribution which allows you to cut all these unstable edges? And if the idea is if it can't cut and learn something meaningful, that's what the soundness result tells you. It tells you that there doesn't exist one. So what do you do when that's the case? Well, you have to relax your invariance spec. You have to be able to say, fine, I was perhaps too conservative. Maybe I'm willing to take some instability in some places because maybe I don't need to give guarantees on all of these areas. Maybe I have to, you know, be more okay with some of these things shifting and have some other way of safeguarding, because this is doing worst case, right? Any shift is going to not allow you to tolerate it. So it's sound and it's complete.
Could I ask a quick question?
Sorry, return distribution is, sorry, one last thing, and yes, and I got confused. So sound means if it gives you something, it is going to be shift stable, it's guaranteed. And then complete is if it fails to give you any estimable distribution, then you know it doesn't exist. In other words, it's not just this algorithm, it's that no algorithm can generate something for you. Yes, please.
Yeah, it was just a quick question about your DRO formulation there. Is the gamma that you have, is that like an F divergence ball, or is that specifically related to these sort of invariant edges in your graph, or?
Yeah, these are basically all possible worlds. So gamma here is all possible worlds or all possible environments, where an environment is effectively take all the stable edges, put any distribution, you know, you're putting a distribution on all the stable edges, and you're taking the unstable edges, putting a distribution on it, except all possible worlds, the distribution on the unstable edges can vary as much as you'd like, right? And we want to be able to protect from wild variations there. So others feel free to add here, but basically gamma is like an environment, and an environment is effectively represented as a graph where you have distributions on the edges.
And is there some limit on how much that distribution can change, or is it can change in any way?
It can change in any way. And that's one of the things against DR, like here we're optimizing for, because we want to give guarantees. If you have balls, you can apply balls, but we don't always know. So in many of these cases, we want to give guarantees that any shifts is bad. And so that's effectively, so it's optimizing against arbitrary shifts.
Cool, thank you.
Adish, did you want to add anything?
No, you got it.
Okay, so let me now quickly go through this because we're short on time. We won't even get to the second part. So I'm going to go fast here because if you're curious, here's a paper that talks about it. It talks about preventing failures due to shift stable learning predictive models that transport. It leverages this idea of how do you specify what you want to be shifted variant to? How does the learner then learn it? And the guarantees, all of the theoretical guarantees are covered in the paper. High level, you have a big graph. You can identify with these S variables, like, be represented graphically. You don't have to, but we find it intuitive to represent it graphically, which is to help identify what are the edges you want to be stable to. You use a selection variable to specify that. And then intuitively, that's similar to, I said we would use causal inference. So it's similar to using a do operator, which cuts edges on the graph. And out comes an estimator. An estimator has this form of the sort. You can learn individual parts of the distribution from data. I'm going to skip all this. You can learn parts of the distribution from data. You can use arbitrarily complex models to fit all of these parts of the conditional distribution. So the good news is you can still use all of your existing learning tools and rich modeling techniques. It's almost like this is a wrapper because it's saying, give me a big data set, give me your invariant spec. Based on that, I'm going to tell you which subparts of the distribution to learn, and then you can use your favorite learning technique to learn them and combine them, and you get the resulting output is a surgery estimator that is stable. There's a talk here. This was a 3-hour tutorial we did at summer school last year that if you're interested, you can click here and it goes into a little bit more details beyond, that's more intuitive than say the paper. And with that, I'll pause on this topic. Any more questions before we switch to part 2? Part 2 is shorter. So in case you're worrying, because we're at the 2:43 mark. No? Okay, perfect. So I think the thing that is cool is like, I hope like most of our learning will shift as we're thinking about deployment more effectively, like, more proactively shift towards when we're deploying something, we need to think hard about all the things we want to guarantee safety against. Then using learning algorithms that give us those guarantees. And then when we're deploying, we're at a happy place. But the reality is we can do all we can. We will still learn new things as we go. And that's what the second and third is about, right? FDA does all the regulation they want to. They still deploy and they still continue to monitor, like in the Moderna vaccine case, right? Like they're still monitoring, are there any adverse events? Are things going bad? So you still want the ability to be able to do real-time failure identification and auditing in addition to that. And so here in this case, this talks about both a much more rigorous evaluation framework for any, and it's a black box, it's a wrapper. So in other words, rather than changing learning, we're saying somebody comes to us with a model, we want to be able to improve the way we evaluate it. So we understand where these models will fail more rigorously than we currently do. So Adarsh, you want to take it away from here? Yep. You can either present or I'll do next slide. I'm happy to do next slide.
Okay, sure. Next slide. So the challenge with performing the kind of evaluation that Suchi was talking about is that these evaluations are sensitive to the sorts of shifts that have been the focus of most of this talk. Because a lot of our existing evaluation tools, things like cross-validation, assume that our new data is coming from the same distribution as our original data. So the gold standard when evaluating under shifts is to assume access to and then assess performance on a set of large, diverse, and independently collected data sets, where obviously there's a heavy limitation on the data availability and the costs required to collect data that differs in particular ways. So the fundamental challenge and the question we want to be able to answer when doing these sorts of robust evaluations is using the available evaluation data, what differences across environments can lead to model failures, and can we identify populations and settings in which the model performs poorly? Next slide. And so through our collaboration with the FDA, we've been working on building out a robust framework for evaluating the stability of machine learning models in these sorts of medical applications. And one output of this work has been, this is a paper that on an evaluation method that we've presented earlier this week at ASSTAT. Next slide. Where the goal here is to perform a stability analysis. So to characterize how a pre-trained model will perform across a range of different populations and environments using the evaluation data that we have available. And so our strategy is to identify a subpopulation on which the model has its worst case average loss, where we need to know a loss function, a percentage, a subpopulation size, a percentage of the original data set. And then we're going to define a shift, a distribution shift in terms of a set of variables W whose distribution can vary, and a set of variables Z whose distribution is fixed. And so we can take the joint distribution of the data and define a shift in terms of one piece of this distribution. And it's a general way to define a shift. Next slide. And so in the paper, we developed this algorithm and estimator. It's called the worst case sampler. And what it lets you do is estimate, compute a subpopulation of a particular size from the original data, which produces the worst case expected loss. But it differs from the original population only with respect to that distribution that shifts. So only with respect to the distribution of W given Z are there differences between the subpopulation and the original one. And so there's, in the paper, you can find some useful theoretical results for this, but most importantly, we get root n consistency for estimating the worst case expected loss, and we get easy to compute confidence intervals.
And just to add, like the variables that are shifting, another way to think about that is from the user's perspective or the regulator's perspective or evaluator's perspective. What are the vulnerable populations or what are scenarios I'm worried about? And they're basically saying, here are all the things, like, let's say I worry about gender, race, comorbidities, like changes of this type, changes of that type. Like it's basically a laundry list of all the things they may be worried about. And then this method will go and look at the laundry list of all things they're worried about to then look in that space possible, find the alpha worst case, for example.
So just as a simple example to see, how what a stability analysis will look like using this method, consider a simple diagnostic model for predicting the presence of a disease from patient data. And one of the shifts that a regulator or a developer might be interested in is how does the performance of the model change as the population demographics shift. And so here we'll consider an example in which the distribution of age and race shifts. So the output of the procedure is a model sensitivity curve, like the one shown here, which plots for different subpopulation sizes. Each point shows what is the worst case performance on a subpopulation of that size chosen with respect to what is allowed to shift. And so for each of these points, we can compute these confidence intervals as mentioned before. Using this curve and using using the model sensitivity curve, we want to be able to answer questions about when model performance, the situations and the populations on which model performance could be poor. Next slide. So an example of this, next. an example of this question is sort of on whom does the performance dip below current baseline standard of care, and who is in a particular worst case subpopulation. Next slide. So we can compute the performance of a baseline model and apply it to the data and look at how does its performance compare to the performance of a new model on its worst subsamples. And using this, this helps us identify what are places on the sensitivity curve that are of interest where we want to do further analysis. Next slide. So for example, here, the baseline model in orange outperforms the new model for subpopulation size 10% or less. And so this is a place where we want to further investigate the properties of this worst case subsample, which is exactly the next kind of question that we would want to answer. So on whom is the performance poor? And so the way that we can do this is we can take that subpopulation and we can actually look at the characteristics of that subpopulation when compared to the full population. So here on the right column, we're looking at the age and race distributions in the full data set versus the left column is the age and race distributions in the subsample. Next slide. And the conclusions that we can draw from this are that performance is worse on older adults because we see that the subpopulation consists of a much older population, while the distribution of race in the subpopulation is almost identical to the distribution of race in the full data set. And so this gives us an exploratory way to think about what are characteristics, where is further analysis needed, where should the model be tuned, et cetera. And by sweeping across different subpopulation sizes, like shown here, we can see how attributes trend across the subsamples. And it gives us, again, this sort of like qualitative notion of where are regions or what are scenarios and people on whom the model performs poorly. Next slide. And so sort of to summarize what a stability analysis like this lets you do is use the variation within the data that you do have available to understand how changes in the population or setting can lead to unsafe use conditions for the model. And so we can, by defining broad types of shifts in terms of distributions, whether they're conditional, marginal, joint distributions, we can take these different types of shifts and understand the changes in settings in which a model would be unsafe to use. So I think that the next slide sort of brings it back together with this all fits together with in the reliability paradigm of failure prevention, failure identification and monitoring and maintenance. So Suchi, I'll let you take away.
Can I ask a question about that? Great stuff. Does that assume there's no confounders? That the decision of what treatments administered is it assumed to be uniform, or can different populations get different treatments, which might in fact influence this? You might be able to see some confounders.
Yeah, so when interpreting a distribution shift in the paper, we actually give some sort of criteria for thinking about what variables to include in Z. If you're thinking about treatment prescriptions, then yes, for example, W would be the treatment, and then Z, you would need to account for confounders in Z in order for the shift to correspond to, how do changing treatment practices vary.
Now, what happens other shift the treatments if the confounders are unmeasured?
Yes, exactly.
If the confounders aren't measured, then when you're computing performance with respect to a shift, essentially there's sort of leak. It's not just due to changes in the distribution that you specified. There can be sort of, or the changes can be affected by these other factors. So when you look at the worst case subpopulations, the subpopulations may differ due to those confounding factors. And so the reason for the poor performance won't be what you observed as the difference between the populations, but the reason for the poor performance will be because of those unobserved confounders that you failed to account for, if that makes sense.
I see. So this is for diagnosing, not for correcting. You'll determine those.
Yeah.
Correct.
Okay.
This is definitely all hypothesis discovery. It's like helping an evaluator understand where things may be like, okay, high level, here's where it may be broken, but doesn't tell you why. It only gives you cues into why.
Okay. Okay.
So that would be a great idea, Russ, if to like think through further, which is now, can we go from here to start thinking about why, so you can pinpoint it more precisely. And when you can pinpoint it precisely and when you can't, like we've left it here as, you know, you could do visual exploratory analysis to see why, but the paper doesn't necessarily try to make any claims that like, we will tell you precisely why. It just tells you now you've identified a region, now you can dig deeper. But from a regulator's perspective, this is valuable because they want to know subpopulation so they can upfront describe it as inclusion, exclusion. You know, like when you see a drug label, people have this notion of like, doesn't work well on diabetics, doesn't work well on asthmatics, this, that, this, that. This is what they're trying to do. They're trying to get to a, doesn't work well on older people with chronic da-da-da, but they don't know why. But they just know that it doesn't. So they can, so anyone who's a user can be informed upfront, a priori.
Okay. Okay, thank you.
So I think that's our last slide. So happy to take more questions as we go. We have only a few minutes. I can hang back and stay a few minutes longer. Yeah, I think this is a super exciting area. The more we can think about how do we start to build algorithms that are shift stable, that actually, you know, like lead to shift stable estimators, algorithm that leads to shift stable models, which both have guarantees, and then also ways to like monitor them, learn them over time. I think the more we're able to, with comfort, get adoption. And I think there's a whole discipline that's going to develop around it. I think already in the last couple of years, I've been seeing increasing amount of excitement, including most recently, Mike Jordan and I have been in several workshops together. And Mike's also been now starting to say engineering isn't a dirty word. Engineering is actually really useful because we want ideas to get adopted. And when we take an engineering point of view, engineering science is all about reliability. It's like knowing, you know, everything is rigorously tested, validated, and we know when we say something works, it works. And we need to bring that point of view to machine learning. And then I guess I'd be remiss if I didn't make a quick thing to say. I mean, there are lots of work we're doing on safety, reliability, but also like, how do we improve the actionability of algorithms and trustworthiness so that users adopt? We've built and deployed ideas through Bayesian that thousands of providers, doctors, and nurses are using. So if there are people who are interested in either the practical side, like they want to actually work on ideas that get adopted by health systems and hospitals and thousands of users, like, please send me a note because I'm definitely looking for people with that interest. But also if you're interested on the more research, like not just the use and application, but also the theoretical side, we're also accepting postdocs in this space. So all aspects of getting things to actually work to, you know, improve outcomes and reduce errors and, yeah, make machine learning work in the real world. Any other questions?
I have a general question that I'd be curious what your opinion on is. I guess it was a really good talk, by the way, both of you. It was really, and I fully agree with this being one of the key areas in machine learning. But one of my concerns is that sort of culturally as a field, we seem to still be quite obsessed with these sort of benchmark data sets and maximizing accuracy or minimizing empirical risk, which leads to models that are quite brittle and don't generalize well. And I wonder, it feels to me like we need a sort of change where we have different environments that are more built to actually test how robust your algorithms are. And I'm just curious in general, what you think of that sort of general idea.
I think it's a great idea. I think my problem is like any data set you come up with, if you come up with 3 data sets instead of 1 data set, then you can overfit to 3 data sets instead of 1 data set. So some of it is like our desire to become more honest and our desire to become more rigorous in our thinking and to move away from the culture of overclaiming. So I think you're right that like we need more awareness. We need around these issues, which then translates into better discussion of the limitations of the work we're doing, better, more rigorous evaluations, and then also hopefully better benchmark data sets. But my challenge with any benchmark data set, the challenge is like, once it becomes a benchmark data set, people overfit the heck out in those benchmark data sets. And you can move 5 benchmark data sets, but then they're just like overfitting to that. So until we change like awareness culture as reviewers and researchers, we're not going to really make a shift. But I think that's happening. I feel like, you know, I've increasingly felt like I've been part of more and more meetings where people are like really starting to embrace the idea. Like MITRE, which is like a big US government agency, has been tasked with trying to develop metrics to improve evaluation robustness, right? So that's an example.
I guess one final question. So first, great stuff. Well, last I want to look at more carefully, especially in the first part of the talk, you use the word learning a lot. Is this learning from observational data or RCT data or both? And do you start by having some model of the world as well? And how does that fit into it? I never quite got a sense of that.
Alish, do you want to take that?
Yeah. So we were talking about observational data because that's, you know, usually the data that we have available. And there's sort of two parts to answering your question. One is, I think that when thinking about the shifts that you want to protect against, there's no getting away from needing to have some understanding of, you know, the world or the problem domain being considered to understand which shifts are relevant, because lots of things are going to change, but which are the ones that are relevant. In terms of needing, you know, understanding then of like, you know, talking about these graphs and things like that, I think the way that we view it is we've also done some work on building out like end-to-end pipelines for doing our best to learn structure from data and incorporate to essentially do some structure learning from data to get like a skeleton of the graph, which can also be infused with prior domain knowledge about, you know, anything you do know about the domain in order to build out what is possible to learn from data. So you can learn some of the graph from data. And we also have extensions of some of these ideas and algorithms to these partial graphs, which represent like an equivalent class of graphs and can work based on what you are able to test and tell from data. But obviously you're much more limited. So the more knowledge you have, the better you're going to be able to do, the more specification of the system you have, the more targeted your answers and results are going to be. So there's sort of like a gradient there of things that you can do, depending on what information you have available.
Maybe a quick follow-up. I talk to lots of doctors who are brilliant people who know a lot about the things, but they're not always correct. If the knowledge you start with isn't perfect, how robust is your analysis to errors in the specification of the priors for the world?
Yeah, I think sensitivity analysis is always an important thing to consider when doing these sorts of procedures. So one of the things is, of course, there's testable implications of you know, some of that structure. So you should test those, right? Test those in the data. But then also where there is uncertainty, to the degree that you're able to limit it, running sort of using different specifications or using different assumed graphs and seeing you know, what is the set of conclusions that we draw from those, are sort of the techniques that like we've thought about in those cases. Because yes, absolutely, it's very possible for that knowledge to not match up with what you're seeing in the data.
I've got to hop off. Great talk. And maybe remind people that Suchi and Darsh have already said they're interested in talking to people. Maybe Sabina will take care of coordinating some of the interactions. It won't be today, but other days, because I'm going to sign up for sure. Thank you very much. Great talk. Great.
Thanks so much for hosting us, and great to see you again, Russ.
Look forward to many more interactions. Bye for now.
Thanks very much.